Fantastic. Diane, do you want to go ahead and take the roll?
Yes, ma'am. Councilmember Dunaway,
Present.
Councilmember Days,
Here.
Councilmember Gray.
Present.
Madam Chair, you have a quorum.
Thank you so much. The purpose of this meeting is to share information about encumbrances and expenditures, contracts that have been awarded, changing needs in the community, and projections of future need, and engage the public in a debate about how future coronavirus aid relief and economic security CARES Act grant money is spent. Before I get into the next bit, if you are not speaking, would you please mute your line, because there is a lot of feedback and it's not the tree cutting. Thank you. The committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. So thank you all so much for being here today. It's been a few weeks since we've met, and a lot has been going on. So I hope that we can have an efficient meeting and get through a whole lot of information. I also want to advise everyone that we do not have Cindy Brinkley here today, and that Cora Faith Walker will be taking the lead on presenting for the St. Louis County CARES team. And with that, Cora, I am going to hand it over to you to lead us in a Department of Public Health overview.
But good morning, Madam Chair, members of the committee. My name is Cora Faith Walker. I'm the Director of Policy for the St. Louis County Executive, Dr. Sam Page. I am very pleased to join you all this morning to provide some programmatic updates about the work that St. Louis County has been doing to respond to the COVID-19 pandemic and recover from this crisis. So with that, I am going to go ahead and share the presentation that I've got with you all. Okay, so just as a bit of a reminder, the overarching mission of the St. Louis County CARES team and initiative is to make an immediate and meaningful impact on public health, humanitarian, and economic areas of concern for St. Louis County residents, particularly focusing on those of us who are the most vulnerable and or affected populations. I thought that it might be good to just kind of start with a little bit of background and just ground ourselves in what it is that really brought us here. It will have been 4 months ago today that the first case of coronavirus was identified and announced in the state of Missouri. It was right here in St. Louis County. That was March 7th, so 4 months ago. And today we are at a total of approximately 7,000 cases in St. Louis County. We've lost 584 individuals. Right now, current hospitalizations in the current census for hospitalizations is at about 273, and we've had a little over 3,000 individuals in St. Louis County released from isolation thus far. I think it's very, very important, again, to just remind ourselves or start with these numbers, because the projections that we got 4 months ago looked very different absent any sort of intervention from the folks that are on this call and you all. And so I think it's just really important to ground ourselves in that. I also wanted to give a brief overview or update of what it is specifically that brought us here, which is the Coronavirus Relief Fund. As many folks know or refer to it colloquially as CARES Act funding, specifically in that Coronavirus Aid Relief and Economic Security Act, which is a much larger, which is a fairly large bill. A portion of the bill that was signed by President Trump on March 27th established the $150 billion coronavirus relief fund program. St. Louis County received $173.5 million as part of this coronavirus relief fund program, as St. Louis County is an area or jurisdiction of over 500,000 people. In the issuing of this new program, or the establishment of this new $150 billion program, and out of the very, very complex and complicated CARES Act, the larger CARES Act, the Coronavirus Relief Fund portion of the Act comprised about 4 pages in total for the $150 billion. And the main provisions that were included in that statutory language that was signed by the president are here for you as follows. So the expenditures have to be considered necessary expenditures because of COVID-19. They are or cannot be accounted for in the budget for whatever jurisdiction that received the funding as of March 27th. And any sort of expenditures or funds that are incurred have to be incurred during a period between March 1st, 2020 and December 30th, 2020. So a couple of months. I think that it's also really important to point out that since the CARES Act was passed and the Coronavirus Relief Fund program was officially established and monies have been released or reimbursed to the various jurisdictions and or states, there have been several changes that have occurred to the guidance that was issued subsequently from those 4 pages that were included in the larger statutory language. The most recent guidance that was updated just last week on June 30th. And so I just wanted to make sure to put that out there for everyone as well, so that we can all understand and appreciate that we're certainly dealing with a sort of changing landscape and are being flexible and as nimble as possible in light of these changes and changing landscapes. And we're going to continue to move forward. So I am now happy to provide some programmatic updates for everyone about the various areas that St. Louis County CARES has identified as priority issues. So just as a quick overview of the structure of the CARES team that is working on the response and recovery from COVID-19. We've got, as part of our leadership on an internal county personnel level, Winston Calvert, who is the Chief of Staff, Hazel Irby, who is our Director of Diversity, Equity, Inclusion, and myself, as well as Cindy Brinkley, who has served as the lead external volunteer for St. Louis County. Additionally, we have county personnel who are working on the administration and compliance portion. So Shannon Koenig, who's the Deputy Director of the Department of Human Services, has taken the lead as the county personnel working on administration and compliance, as well as Beth Orrick, Todd Martin, Jen Keating, Vicki Frederick, Chuck Henderson, and Paul Kreitler, who have all been working very, very hard to make sure that we're able to get that $173.5 million out of the door and into the community. Now to what the Madam Chair specifically talked about as we began the public health pandemic, or the public health response, and the work that's been going on with that. So just as a reminder, public health is one of the main priority buckets that has been identified as an area of response. And the main goal of the public health area is to save lives. We're aiming to do that by a lot of different programs, including community awareness increasing, working on enforcing social distancing requirements, and then obviously making sure that folks are able to get tested, that we're able to isolate people, and then also that we are able to mitigate the spread of COVID as well. So just to get a little bit more into detail and to return back to that organizational structure, the two internal county personnel who have been taking the lead for the public health response are our acting co-directors of the St. Louis County Department of Public Health, Spring Schmidt and Emily Doucette. Additionally, Paul Hensey, who's joining us this morning on the phone, has been incredibly helpful and instrumental as the lead external volunteer for the public health response. As a reminder as well, and I know that this is information that you all have received before, the public health bucket comprises about 30% total of the $173.5 million in coronavirus relief funding that has been, that St. Louis County has received from federal government, for a total of about $51 million specifically designated to the public health response. As part of that, we are doing and looking at a couple of different areas, all of which have been in process and are continuing to move forward. Contact tracing and case investigation, which goes a very long way into the prevention aspect of the overall mission of the public health area, as well as testing, providing PPE, supporting community health providers, and then finally including an area or support for mental health as well. Just as an update to the contact tracing and case investigation portion of the response, I understand that there are a couple of questions about that. And so we have approximately 200 volunteers who are currently engaged in contact tracing and investigations and have hired 57 staff since the contact tracing position was announced and created. We've got a total of 100 contact tracers that are going to be hired. And we've got 2 that will be starting next Monday to add to that 57. And there are also interviews that are being conducted this week to bring in more. I think one of the things that we are realizing about the health crisis and pandemic is that this is certainly more of a marathon than it is a sprint. And so we are trying to be very thoughtful about ramping up to the 100 contact tracers that we've, or that the public health department has decided are necessary at this point in time. And the idea is that this is going to be something that will likely be an ongoing sort of position just because of the nature of the virus, how it's spreading, and the folks that are being infected and affected by the virus so far. So just a little bit more information about the contact tracers. Over the weekend, there were 41 volunteers that have been onboarded or brought on. And so I think this is a really good mix of use of taxpayer dollars, as well as folks who are willing to volunteer. The volunteers are primarily pre-med students, nursing students, MPH students, and so on. And so a lot of young people are getting an opportunity to help and pitch in. And so this is something that we're very, very pleased with. Additionally, there continues to be a procurement of services and vendors to round out the public health response. There is going to be a new invitation for bid for testing kits and lab services that will be issued coming up in the coming days. Additionally, there's been a contract for a call center to help answer questions that individuals have, both related to COVID itself and as well as related to the reopening guidelines that have been issued and established by the Department of Public Health. There's been translation services. If you go to the STL Corona website, there's a multitude of languages that the website is able to be translated into. And so as we're talking about outreach, communications, and awareness of what's going on, that is a very, very important component of our response as well. And then the COVID at home, initiative or program is also going to be put out for a request for proposal coming up in the coming days. Finally, in terms of the current awards and expenditures, we are also working with our EMT partners and ambulance services to be able to provide or help provide ambulatory testing as they're out and about in the community. So right now we've got a total of about $1.8 million from the public health component that is actually been expended. And we have a significantly amount more that is, as I showed before, that is still in process of being released to the community. One of the things that I do want to point out that is upcoming is related to the community health portion of the budget and the response. And that is something that has been informed by the participatory budgeting process that was recently concluded, where individuals from the community and other organizations were asked to go onto the STL Corona website to indicate what sort of areas they think the county should be focusing on as part of their public health response to COVID-19. And based on that information, a scope of work is being developed this week. The scope of work is being developed this week, and applications for that $5 million from the community health response and the $2 million for the mental health will be released next week based on the feedback and information and data that was gathered from the participatory budgeting process. Contracts for that specific portion of the funding or the response is slated to start or slated to start earlier in early August. So around the time that folks are considering going back to school and so on. And so the timing of all of this and the community health and mental health response certainly seems to be in line with the trends that we're seeing right now with the spread of COVID-19 in St. Louis County. Additionally, as part of the public health response, there has been a CARES specific procurement policy that has been established that really does try to prioritize public health over everything. And then there also have been very distinct processes that have been established for procuring professional specialized services that are a very important part and component of the response, specifically around testing, and then goods software, and then general services. So I will pause. I know that that this has typically been more of an an interactive sort of a hearing, and so I'll pause there to see if folks have any questions before I move on to the humanitarian.
Madam Chair, I have a question.
Madam Chair. Madam Chair.
Yes, Councilwoman Days, I'm going to let you go first, but I will get to you in a minute, Councilman Tracus.
Thank you.
Thank you. Let me ask Cora Faith a question about the residents that participated in this budgeting process, and was there a cross section of participants? That's my question.
Yes, ma'am. Yes, madam, or yes, councilwoman. I'm not sure to call you senator or councilwoman. There certainly was a cross section. The folks that worked on selecting the individuals who are going to be part of the community review for the participatory budgeting process are absolutely from the community. We can certainly share the names of those individuals with you, but I want to be clear that no one that's working directly on the CARES team selected these individuals themselves. This was part of, or this was a continuation of the recast grant process, where there were monies that St. Louis County received and some other areas received from the federal government a couple of years ago in the Promise Zone areas. And the individuals that have experience with the participatory budgeting process in that case have and were asked to help with the selection of the individuals to review the community reviewers for this case. And so many of them applied. Many of them have had experience doing community review before. And while we haven't gotten to this portion of the review process for the public health response, we did have community reviewers for the humanitarian response, which I'll speak to here momentarily. And the applications that were received, and their feedback was very invaluable in determining the organizations to sponsor. But I'll be happy to get you the list of the folks that are going to be participating as part of as community reviewers for this this section of the public health response.
Thank you.
Selected.
I want to go back to the public health portion where we're talking about the testing. At one point, the suggestion was that we just test everybody. And I want to know, what is the capacity for that? Are we able to test everyone who wants to be tested, or how is that going to work? Because the concern has always been we don't have enough tests.
Yes.
So how is this going to happen?
Yes, so we are continuing to try to ramp up testing capacity. And a couple of weeks ago, when we began soft reopening, if you will, the county public health department was in a position where they were able to test everyone that wanted to be tested. There might have been some sort of some delay in scheduling a time, but folks would be able to go online to the STL Corona website and make an appointment for a test and get tested. What we're seeing,
and that is just for the county's portion. Of course, the privates that have done this and continue to do this, they have a different system. And so I guess, is their pipeline a little different than ours? Because we're only operating 2 from St. Louis County, if that information is still correct.
Yes, that's absolutely correct. That's the point that I was about to make. What we're seeing now, even with the private testing providers, is an increase in demand. I think as a response to just the sort of numbers that are trending really outside of St. Louis County, in other parts of the country and in other parts of Missouri. And so in addition to the testing itself, the tests have to be, they have to be processed in a lab. St. Louis County, as a public health department, does not have the capacity to do those lab, that lab processing, but we are looking at contracting with other agencies or organizations that can process the labs. And before, that has included some of those private providers, but because of the increased demand and the delay that we are seeing, and that is part of a larger trend that we're seeing across the nation, that's certainly something that is going to be taken into account, because the last thing that we want is for people to go get tested and then have to wait for an extended amount of time to receive their test results.
Because right now, I think it's 3 days that you have to wait, I think.
That's what it depends on which test you get, but it can range from anywhere from 2 to 6 days. But what we've seen and observed from some of the private providers and the private lab processing companies is delays that are closer to 10, 11 days. And by that point in time, that's right around the time that if you've come into contact with someone and you're not symptomatic, 10, 14 days, you're supposed to be able to be out anyway. And so we don't want the delays in processing of tests to end up discouraging people from actually getting and then test results. But that's certainly something that we are cognizant of.
Okay, and my last question has to do with the uptick in numbers. Are we experiencing the same uptick that a lot of states are experiencing with we have reopened so much, and so the numbers have ticked up considerably in Florida and California, places like that. And so I'm curious as to what that looks like in St. Louis County.
Yeah, that's a very, very good question. So we've been a lot more measured in our reopening response in St. Louis County than some of the other states that you mentioned, like Florida, like Georgia, like Texas, who just reopened across the board, even Missouri that reopened a couple of weeks ago. Here in St. Louis County, obviously, we are in the process of phasing in reopening, starting at 25% a couple of weeks ago, then at 50% of capacity for businesses more recently. And I think that because of that, the spike that we're seeing and how rapidly it's rising, and the numbers are rising in some of those other areas are not being reflected here. That said, there is certainly an increase that is occurring. However, the increase that is occurring is not, or has not been rather, as quick and rapid of an incline as some of those areas. But okay, we're certainly watching it, and our Department of Public Health has thresholds that they have established that will determine or help inform whether or not the reopening should continue in the path that it's going, or if there should be an adjustment that's made.
Thank you, Madam Chair.
You're welcome. Councilman Tracus.
Thank you, Madam Chair. Ms. Walker, thank you for your presentation today. I just have a couple of very, I think, straightforward questions. If I understood your presentation correctly, including the current awards and expenditures, am I correct that the budgeted amount for public health, or the public health bucket, as you've described it, is $102.5 million?
The current actual expenditures that have occurred in that public health and for the public health department is $1.789 million.
No, I understand that. I guess my question is that in addition to the $100.7 million you've allocated to the public health bucket, or is it out of that?
So there's been $51 million allocated to the public health bucket. And so that $1.7 million is from that $51 million that's been allocated.
Okay, so the total amount to the public health bucket, as you described it, is $51 million?
That's correct. Yes, sir.
And the current awards and expenditures are out of that $51 million?
That's correct. Yes, sir.
Thank you for that clarification. And then you mentioned in response to Councilwoman Days' question that the Department of Public Health has established thresholds with respect to the limiting of or the retraction of the easing of stay-at-home orders and the reopening. Are you at a liberty to share what those thresholds are with us today?
I can pull them up, or we've got some folks that are from the department on the line. So I don't know if they want to do that as well. Otherwise, I can send you all the documentation, whatever you would prefer.
Well, I don't want to belabor it. I think if you can send it to us and so we know exactly what these thresholds are, that would be helpful.
Absolutely.
Thank you, Madam Chair. That's all I have.
You're welcome. Yes, Councilman Harder.
Thank you. Ms. Walker, a couple questions. How much control does our health department have over the private sector testing facilities?
In terms of control, I'm not entirely sure. There is a public health order that has been issued by our medical director, Dr. Doucette, that requires the private testing facilities to submit results to St. Louis County within a certain amount of time. However, it's more of an agreement than it is anything else. I wouldn't contemplate, because of the delay in the private testing, that somehow St. Louis County or someone from St. Louis County would go and try to hold them accountable for not sending in that public health or for not sending in the data within a certain amount of time if they just don't have it. And so, but kind of outside of that, there's really not any control, but there is collaboration, is what I'll say, or an attempt at collaboration.
I guess my question is that if I were to get tested at a St. Louis County facility, and I guess you're not doing the rapid test, but to do the long test, how long would that be to get the results?
From St. Louis County?
From St. Louis County, if I walked in there today.
I don't know, but I can get just what the average wait time is for you, and I'm happy to send that to you.
Not the wait time to take the test, but to get the result.
Yes, exactly. The wait time. I'm sorry, I consider it wait time for waiting for the test results. But yes, I can get that average time to you.
Because the reason I ask, I've got a good friend's son that needed to be tested, and he went to an Access Urgent Care, and over 12 days ago, he still has not gotten his results back. And this is a private funded establishment. So anything short of that, I mean, like you said before, we're at 12 days. He has not gotten his results back. 14 days, you're out of quarantine.
Go out of quarantine, exactly.
So why even have the test at that
Precisely.
point?
Yeah. Anecdotally, I got tested from a private place about 10 days ago. My husband called them every day, including on the 4th of July. And we finally got the results back yesterday. And so our results were delayed about days from when we were expecting to receive them. And so, I think it's what I've noticed is it's part of a larger national trend. But I can certainly get the information to you about how the St. Louis County tests and the amount of time between the tests being returned have
Do you want me to get you some answers for that?
Oh, yes. Is Dr. Hensey, would you? Yes. We've got Dr. Hensey.
Well, if you come to the county and you get tested, the turnaround time here is 2 or 3 days right now. The reason there's such a long turnaround time at some of the other facilities is because they're using Quest as their testing vendor, and Quest is a national company that's overwhelmed right now, and so they are having a hard time keeping up. We use SSM Labs for virtually all of our testing, and they get their result back to us in a day. So if we can get it to you in 2 days, that's our target.
Okay, and then finally, if we can believe the stats on the CARES Act website that talked about positive tests, negative tests, it looks like based on their chart, I'm looking at it here, we've only had a 4.2 positive rate out of all the tests. I think we've now administered 94,000 tests in St. Louis County, of which 4.2 has come back positive. That doesn't look like a spike to me when it comes to these numbers. So why are we seeing national media talking about this huge spike and we're not seeing it here, but we're treating our people like we're New York or LA? Anybody can pick that one.
Okay, well, I'll let Dr. Hensey answer the public health part, and I can answer the other part.
So this is Dr. Hensey again. We are seeing a slight rise. If you look at the STL Corona website, you can see that our numbers are up a little bit. Our average daily numbers are up, and when I say a little bit, I think we were averaging about 2 weeks. We were averaging 2 or 3 weeks ago. We were averaging 40 a day, 42 a day, and now we're averaging more like 70 or 80 a day. They're not resulting in the hospitalizations and so forth because the population we're seeing is younger and healthier, but we are seeing an increase. I don't think we're seeing the kind of spike that has been described elsewhere right now. We're wary, and we're trying to be sure we understand all the components of the people who are positive these days.
So you're saying the positive cases are happening at a younger age because we're not seeing the deaths. We haven't had a death in over 7 days based on the stats on the website. And we're looking at a negative tests are dropping, positive or not even on the chart. So is that because this is a much weaker strand coming at the end of this and it's not affecting people to the extent that they need hospitalization?
No, it's because the population of people who are getting the virus is younger, and I guess that's good in the sense that it's not resulting in the level of hospitalizations and ICU admissions and so forth. But it does indicate that there is much more community spread. A month or two ago, the cases were in nursing homes and in older populations. Nowadays the cases we're seeing more community spread, and as we increase and open up activities, that is a bit concerning about the increasing community spread. Eventually it will result in some more vulnerable people getting the virus, and we worry about then increasing hospitalizations and increasing deaths.
Would you say that when this happens to a young person, it's more like normal flu symptoms, but when it happens to an older compromised person, that it is more overreaching in their health?
Well, younger people tolerate the virus better, that's clear. The percentage of people who are asymptomatic in the older population is amazingly high as well. So in nursing home, 20 or 30% of people who have the virus are asymptomatic. So there are fewer symptomatic people in younger populations, and they certainly tolerate the virus well and usually have a bad cold or a flu-like syndrome that passes in a few days.
Because this is the last piece of this, but the person I talked about, this friend of mine's son, the only symptoms he had, he lost his sense of smell for about 3 days, and he had a fever for about 2 days, and that was it. And he's fine. He feels fine right now. But he did a rapid test. The rapid test was positive, but he still hasn't gotten back his long-term test at this point. So is that pretty typical
It's
how this
difficult to
affects?
lose taste and smell with this particular virus.
Okay. Thank you.
Thank you, Councilman. Councilman Tracus, did you also have a follow-up?
Yes, Madam Chair, thank you for accommodating me. Ms. Walker, if you wouldn't mind, if you could go back to your recommended budget slide.
Yes, sir.
Thank you.
I will try to. All right, there we are.
So I understand you said that you have $51 million, $51.6 million in the public health or the health bucket, but isn't it fair to say that every other item on this budget that you've laid out here is inextricably tied to public health?
Yes, I think all of these are a component or are part of the public health response. Yes. I mean, are you talking about this here in front of us? Yes.
Yes. So to be fair then, adding all those together is how I got to $100.7 million. And wouldn't it be more accurate to say that 100.7 million is what's been allotted to public health?
I apologize, Councilman Tracus. The health saving lives at the top should be, that's the total amount. Okay. So I should have made that a separate color.
Okay.
Slide. So yeah, so that total, that at the top is the total amount that's allocated to public health
So
pricing.
everything else there is
everything below that.
Great.
Correct.
Thanks for clearing that up for me. Appreciate it. Thank
Absolutely.
you,
I apologize for the confusion.
That's okay.
Yep, you're
Thank you,
welcome.
Madam Chair.
Yep. Are there any other questions before we move on? All right, Cora, I think we're ready to talk about humanitarian.
Okay, great. So as a reminder, the Humanitarian is relief initiative is the second component of the response and recovery to COVID-19 in St. Louis County. The main focus and mission of the humanitarian relief response is to help meet the basic needs of St. Louis County residents, particularly focusing on areas around food, housing, health, safety, and addressing some of our most vulnerable populations in the county, children, the disabled, seniors, and unhoused individuals. So again, just as an overview, we have that we've got Andrea Jackson Jennings, who is the director of the County Department of Human Services, and Emily Koenig, who is the acting director of St. Louis County Children's Services Fund, who are the co-internal county personnel leads, and then Deborah Patterson, who has been the external county volunteer. Again, as a reminder and as part of the budget, the humanitarian response comprises about 14% of the overall $173.5 million that has been distributed to St. Louis County as part of the CRF funds. And there are a couple of different areas of that bucket. The grants that have been, that were awarded for food security about a month or so ago, about 2 months ago. The Child Care Relief Program, which is about $5.9 million that's been allocated. And then finally, the humanitarian response portion of the program, which includes work and initiatives around childcare or child wellness, social and emotional support, senior and homebound programs, housing stabilization, and then finally the digital divide. And so focusing on technology and internet access supports and services. And so the humanitarian bucket, that second portion of the humanitarian bucket, so not the food portion, was announced by the county executive, a little bit over a month ago. So on June 3rd is when that area or that program was announced. And the applications, the deadlines for those applications for the housing stabilization, the senior and homebound services, the prevention, and then the social and emotional support for children ended on June 17th. Since that deadline, there have been reviews done both externally by individuals from the community as part of the participatory budgeting process, as well as internal review from the county staff and personnel. And overall, the applications for that funding area were complete last week, and applicants will be notified today of the award decisions. There were a total of 87 applications that were submitted to the humanitarian response for the areas around housing stabilization, senior homebound, technology, and childcare. And out of the 87 applications, there were 80 organizations that submitted 87 applications. So a couple of organizations submitted applications for multiple areas of funding opportunities. 60 of the total of 80 organizations were awarded some level of funding. And out of those 87 actual proposals that were submitted, there were a total of 64 that received some level of funding. Do I have a breakdown here? I don't. So just as more of a breakdown about that area of funding, there was $6.97 million. Let me go back to this. $6.97 million out of the total allocated of $7 million for housing stabilization and prevention. Additionally, $827,000 total has been awarded for the senior and homebound programs. The amount awarded for the child wellness / social and emotional well-being of children totaled the $500,000. And then the technology and digital divide internet access portion of those humanitarian awards totaled $995,000 approximately. So out of $9.5 million that was allocated for this specific portion of the humanitarian response, $9,290,397 total has been awarded. And as I stated, those recipients will receive those awards, that award notification later on today. As part of what we have done or has been done with the administration of this specific program, there have been multiple trainings and webinars that have been provided. There were 4 that were provided initially after this initiative was announced. All of those webinars were recorded and made available to individuals if they couldn't join at the specific time. Additionally, another webinar is going to be held this Friday to go over the award process. It will be an opportunity for organizations who have not received an award to get feedback about some of the overall trends that were noticed about the applications, what the strengths of the applicants who were awarded were, and where some of the areas of improvement exist for applicants and organizations who did not receive any sort of funding. After that webinar that will be held this Friday, that will also be recorded, organizations that did not receive funding will also be able to receive individualized feedback if they so wish from the group of folks who have reviewed the applications and who can help, I think, inform organizations about ways that they can improve for future, potential future funding opportunities. One other thing that I want to mention about the humanitarian component is that the $5.9 million that was allocated specifically for childcare providers, the original deadline for providers to submit applications for those funds was June 30th. However, many of the providers are smaller providers and were in need of technical assistance. So there has been an agreement to collaborate with a couple of larger childcare advocacy organizations, including United for Children, and they are providing technical assistance for childcare providers, and the deadline for applications for that funding area has been extended to July 14th. We're currently considering whether or not to push that date out a little further, just so that we can make sure that the providers are able to get access to this funding. But right now, we've made that one adjustment so far to extend the deadline to July 14th. So I will pause there to answer any questions.
Madam Chair.
Madam Chair.
Okay, so Councilman Harder, I'm going to let the committee members go first, and then I will get back to you, I promise. So Councilwoman Days, I'll start with you, and then I'll get to you, Councilwoman Gray.
Thank you very much. Cora, I want to know about the food deserts for the children. Initially, when this started, the schools were providing lunches or at least 2 meals a day for these children. Is that in your humanitarian relief proposal here? I didn't see anything mentioned specifically about the children.
Yes, thank you. Thank you so much for raising that question, Senator. So, Councilwoman. So the initial award of funding for the food distribution and food security took into account partnerships between the organizations that were funded and schools who were doing food distribution. And so, let's see here. So both Operation Food Search and the St. Louis Area Food Bank, but particularly Operation Food Search, have established relationships with a lot of school districts who are located either in food deserts or whose students primarily are on free and reduced lunch. So as an indicator of the need for additional support for food security in those specific areas. And so by funding Operation Food Search and then some of these other areas, there was a specific focus or question about whether or not the distributions would occur either in school districts where there are food deserts or where there's a high need for food security, and or just providing the food directly to the schools to conduct their own distribution.
Okay, so if I'm hearing you correctly, then Operation Food Search is partnering with the various school districts to make sure that this happens.
They have, yes.
They have. Okay, the other question is, looking at all these amounts here, we had discussed earlier about whether these people had received their funding. So let's just say the Urban League requested $500,000. Have these organizations received that money? Have all
Yes,
of
Senator,
these organizations listed here have received that money?
Yes, Senator, it's my understanding. Yes, Councilwoman, it's my understanding that all of these organizations have received funding. In fact, as part of their funding agreement, they are responsible for providing information and documentation about how the monies they've received have been used so far. And that deadline for getting that preliminary documentation back was a week ago on June 30th. And so they've all received funding, and we are in the process of receiving back from them the data about the areas that they've served, the number of people that they've served with this funding thus far.
Okay,
I'll remind you that was only 3 months of funding, and so one of the things that we are looking at, because those 3 months are coming rapidly to a close, and so we will be looking at and considering whether or not there should be another round of funding that is available for the food security initiative.
Well, since I'm speaking specifically of the children right now, this will have to happen at least until school resumes. And we're not really sure. I read something about, the resumption of the school in September. But at least until that point, we're going to have to make sure that there is some kind of food distribution for those. So in other words, if Operation Food Search or St. Louis Area Food Bank, I should not be getting calls that they have not received the 1.3 and the 655, et cetera, on down the line. That's correct?
I sincerely hope you are not receiving those calls.
I hope not either. Let me ask you also about the, you talked about the webinars and the assistance for some of the child care providers to get, I guess, technical assistance. Is our Children's Services Fund, do they have the capacity to do that? Or are they involved in that process at all?
Yes, so the Children's Services Fund, I'm actually contracted with another organization that works directly with a lot of the providers to provide that technical assistance for them for applying for this program. I mean, there's even one of the organizations that's been engaged is even just providing laptops and internet access. The digital divide, which is one of the components of the humanitarian response, is something that is not limited to children. And
absolutely.
And so the organizations that that Children's Services Fund is engaged and worked with to provide the technical assistance is doing really kind of a broad range of technical assistance that is about like actually applying for the funding and helping folks with the application itself, but also providing actual technical or technological support as well for some of these organizations. Otherwise, the other sort of 4 webinars, there were 2 that were related to the child care relief program, and then 2 that were related to the other humanitarian programs and grants that had been, those webinars were led by folks from Children's Services Fund, who really just kind of helped folks walk through all of the different areas of the applications and the different requirements for documentation and that sort of thing, and you know, even how to submit the application. So that yes, they were well positioned to provide that webinar or those webinars and that technical assistance and support.
Okay, and my last question had to do with the seniors. How are you doing the outreach? A lot of our seniors are homebound and they can't get out. They have perhaps limited access, if any at all, to technology, internet, et cetera. And so how are we providing the information to seniors that are vulnerable at this point?
Yes, that's a very, very good question. So one of the components and criteria that was taken into consideration for funding for the organizations that applied was exactly that, whether or not organizations had established relationships or a presence with seniors because of many of the barriers that you just highlighted and identified. As we were making decisions about, or as the reviewers were making decisions rather about how to get the money out of the door and who to fund, we realized that there are a lot of folks that are in need right now. And so we couldn't really wait for some organizations who, you know, would, I think, be very good at doing this work and certainly have an interest and a mission that's aligned with doing work to support seniors and homebound individuals, that there are a lot of folks that are in need right now. And so we prioritized organizations that had established relationships with seniors to try to address that. Additionally, there has just been, you know, we've just tried to rely on a lot of networks, rely on, you know, you all in the council to try to spread the word about this funding opportunity itself. But when selecting the organizations, we really went with groups that have already been in this space and have been doing this work and just need resources to increase their capacity to serve more people.
Thank you. Thank you. Thank you, Madam Chair.
You're welcome. Councilwoman Gray, did you have questions?
Yes. The senior and homebound program, what type of money or not money, but what type of programs will that money pay for, or what is it being used for?
Yes, so a lot of it really relates to just food itself and making sure to provide meals to organizations, to seniors and individuals. And so that's one of the real sort of primary focuses of that. The way that the food distribution, the larger or the separate food distribution funding was established, those are typically, you know, drive-ins. You have to go to a specific location. And so, you know, we recognized working with folks in this area that only captures a segment of people who are experiencing food insecurity right now. And so one of the primary focuses and components of this funding and organizations that were selected for funding is around them providing meals to seniors who are unable to, for whatever reason, travel to the food distribution event sites that were established with our funding.
So is this going to be Meals on Wheels or a separate program similar to Meals?
I would say it's similar. That's probably one of the best ways to characterize it. It's similar.
Okay.
Organizations that receive funding do something similar, rather.
And as far as you say there's a separate pot of money for, well, let me go back to the food. I do know that Operation Food Search is giving money to the, not money, providing food to the libraries currently. The school districts have distribution sites probably 2 or 3 times a week. Well, Hazelwood is once, and I think Riverview is twice. Not sure about the others. I'm sure that's planned to continue throughout August, correct?
That's correct, yes.
And then the Lynx Market, I was told, is up. I think they're either going to be up on Friday or this past Friday. Oh, do you know?
I'm not sure, but I can get that information for you.
Okay. I know you mentioned Friday, but I can't remember if it's past Friday or this upcoming Friday. Pot Bangers, have you heard much from them?
Not since we got them their award.
Okay. Okay, other questions. As far, and I don't know if this is for you, the testing, how often can someone be tested at the county location?
I'm not aware of any sort of limitation on the number of times someone can be tested, but I will be happy to defer to Dr. Hensey if there's if he wants to correct me on that. But I'm not aware of any sort of limitation.
Okay.
It's Dr. Hensey on.
I'm on. I'm not sure I heard the question. I'm having troubles with my audio.
Dr. Hensey, there was a question about the number of times an individual can be tested for COVID in St. Louis County, and I shared that I wasn't aware of any sort of limitation on the number of times someone can be tested.
Meeting at the health department.
Yeah, there's no specific limitation. Especially for curious people, we know that they're getting tested more than they should, honestly, in some circumstances. But we haven't established any, I'll say, guidance or rules or regulation around that.
Okay. Of course, I would assume if you in one of those situations where you have continual contact, such as a nursing home, I could understand that. The Humanitarian building you said was last week, and knowing issues we had with SBR, is there going to be a great effort to help people make it to pass or not have failed applications?
Yes, and thank you for asking that question. So I think that one of the things that we try to do to be proactive about that and that possibility is hold or host those webinars early on after the funding opportunity was announced to help people who are applying understand the full components of the application and understand the different documentation that would be required for participation and ultimately or for receiving awards and ultimately participating in the program. One of the, I think, one of the key sorts of differences or characteristics, the key differences between the individuals and the organizations that apply for the humanitarian and then the small business relief is that many of the organizations that apply for humanitarian are nonprofit organizations, so are familiar with and have experience with keeping that sort of documentation on hand and being able to provide that documentation in order to receive funding awards. That said, there were certainly several who did not meet either the criteria of the application itself or had more specific sorts of shortcomings, if you will, for their application that limited their ability to receive an award. And so that's why we're having the Humanitarian Relief Group is having the webinar on Friday to walk through what those, kind of what some of those areas of improvement were for the applicants, as well as provide individual feedback to the applicants that so choose to receive that feedback.
Okay, sounds good. I had something else, but I forgot what it was. I'll come back. Thank you.
Okay. Thank you. Councilman Harder. Councilman
Thank you.
Harder? Are you-
Yes,
okay.
yes, I will hold my questions. We need to get on to the small business relief. I'll hold my questions for that. Thank you.
All right. Councilman Tracus had a question as well.
Thank you, Madam Chair. The humanitarian relief bucket, the total $24,150,000. That's the top line on your slide, correct?
That's correct, Councilman.
Okay. And then that figure is arrived at by all of these other subcategories, for lack of a better way to put it. That's how you get to the $24,150,000.
That's correct. That's exactly right. Yes.
Okay. And so are there any other expenses or monies allocated under humanitarian relief that are not shown here?
No, sir. This should be the full amount. The way that the budget was presented earlier to the committee and the group had an accounting for certain administrative costs that were related to this, but so that you might, if you're comparing the two, you might notice that sort of a difference. But yes, this should be everything.
I do the math on your itemization there a number of times, and I come up with $23,010,880, about $1.1 million, a little bit more than that, less than $24,150,000. So I'm a little concerned that there's $1 million that apparently is unaccounted for.
That's correct. Yes, so that's correct. That is the administrative portion of the funding. So like I mentioned, the previous version of this budget had that amount included as well. But yeah, it's about $1.14 million that is going towards just the administration of this.
Can you give us a little, is that going to a private entity, or is it exactly, where's that money going, that $1.1 million?
So it's a combination of a couple of different things. A large component of it, and for this and the small business relief, which we're going to be getting to, is around, goes to Reuben Brown and the independent accounting firm that is verifying the documents and the materials that are received from the different applicants.
We're hearing you. Counting on my end, Cora, so you can just get back to me with that information later.
Yes, absolutely. Yes, I will be happy to provide the committee and everyone with a breakdown of those different administrative costs and where that's going.
Okay, I appreciate it. Sorry for the.
All right, great.
Okay, so if there are no other questions about the humanitarian, we will move on then to the economic recovery portion. Hello?
I think there's just some echoing and some, I think you're fine to move on to economic recovery.
Okay, so just as a reminder, the third bucket is on the, it relates to recovery and reviving the local economy. And so really looking at ways to support small businesses and be responsive to the areas of concern that we are hearing from businesses and folks in the community that really do drive the economy forward. And so as a quick overview, the lead county personnel internally working on the economic recovery portion is Jansen Thomas, who is the Deputy Chief of Staff for the county executive. The lead external county volunteer is Rick Stevens, who is joining us on the phone this morning, who will be talking momentarily about the economic recovery team. I just wanted to quickly talk about and look at the budget again for that. And to your point earlier, Councilman Drake is here. We've got the $1.1 million that's included as part of the administration of the program. And so I'll be sure to update those, that information, those numbers for you and for the council. But originally $1.75 million in grant funding was allocated for the Small Business Relief Program, which was announced on May 1st. And then there's been an additional $5 million or so that has been unallocated. And that is something that the economic recovery team is supposed to be looking at. And so before we kind of dive into the Small Business Relief Program, I want to take a moment to turn the presentation over to Mr. Stevens, who is going to provide a little bit more update or information about the economic rescue team.
Yeah, good morning and thank you. Good morning and thank you. So the economic rescue team is made up of a steering committee, and there's 6 of us on the steering committee, including myself as the chair, but also Frank Jacobs, who's the business manager of IBEW Local 1, Vita Jeffrey, executive director of the Heartland St. Louis Black Chamber of Commerce, Kelly McCoy, who is the founder and CEO of the Chandra Group, Dr. Jeff Pittman, who serves as chancellor for St. Louis Community College, and then Rodney Krim is ex officio, but as CEO and president of the St. Louis Economic Development Partnership. So we make up the steering committee, but under the steering committee are 4 working groups. And the first one is small business and industry, and Kelly McCoy, who sits on the steering committee, is chairing that as well. Community development, nonprofit and alternative lending, Brian Phillips, who is the executive director from WashU, who serves as the executive director and assistant chancellor for their Center for Redevelopment, chairs that. And workforce development, Tiffany Davis, who is the director of workforce development for St. Louis Community College, chairs this important working group as well. I will also say that the steering committee members are involved in the working group. So you notice Kelly is chairing small business and industry. Frank Jacobs is the liaison for workforce development, even though he's not chairing it. And then Dr. Jeff Pittman is the liaison from the steering group for community development. And then the last working group is minority and immigrant-owned small businesses. And Vita Jeffrey, who was also on the steering committee, is also chairing this as well, who serves as I said before, the executive director of the Heartland St. Louis Black Chamber of Commerce. We're very thoughtful in the individuals that serve on the working groups. There are probably 10 to 15 individuals that serve on the working group. A lot of it, majority of people apply, and we were able to find a working group for everyone that has applied. We were very thoughtful in the individuals on the working group, especially from a diversity standpoint. And then we also have individuals from each one of the county districts as well participating in the working group. So we wanted to make sure that we spread out the members and spread out the participation. I think we've done that, and we've done that in a very thoughtful process as well. And so if we go on to the next slide. So from our objectives and deliverables, the first out the gate, because the group has only been meeting within the last 3 weeks or so, but identify opportunities for executive orders, which would include temporarily suspending county ordinances so it can provide economic stabilization. So identifying those ordinances that are out there that we can give to the county exec to say, okay, hey, this would create more economic stability in the region here as well. And then another objective and deliverable is prioritize policies and achievable action items for economic stability and recovery, including opportunities for proposed council legislation as well. And then what we want to do is get to number 3 is recommend long-term actions and policies, including economic benchmarks that will demonstrate intermediate and long-term economic recovery. So we think those are very deliverable. Those objectives are very deliverable, and the working groups are hard working at all of these currently right now. And also you'll see as part of, I think, CoreFace's budget as well, there's $5 million for the working groups to come up with as part of the deliverables of how much money they think that it would take for, say, workforce development of that $5 million, or community development, or for small businesses and immigrant small businesses. So I know there's a lot of creative juices. There's a lot of enthusiasm from individuals on the working groups as well. And so that kind of summarizes the economic rescue team. Are there any questions I could answer?
Madam Chair?
Councilman Harder.
Yes, Rick, how many people are on your committee that are actually business owners?
Oh, there's quite a few. Jansen maybe could tell me. No, there's, especially workforce development and minority development, there's quite a few. I don't have the number, but we can get back to you unless Jansen may know off the top of his head right now.
Okay.
A lot of business owners are on that workforce development. Kelly McCoy, who owns the Chandra Group, is a business owner, and she's running a small business.
Okay. Second question is, how much of the money that you are going to spend will actually get to small businesses to help bail them out?
Well, I think that's the slide Cora is going to come back to. There's a 17.5 that Cora Faith is going to talk about those couple of slides, and that 17.5 million is slated to go out this month, or maybe starting this week or sometime as well. So Cora Faith probably will have, or other staff will have more information on that. I think you're coming back to that, those two slides here in just a second.
Confusion. The 24 million that is part of the rescue team, how much of that is actually going to get to building businesses in the area?
I believe it's the 17.5 million.
Can we go back to your budget slide? There. So 24 million is the total, of which 17 will be the grants to small business, correct?
Correct.
Okay. And so unallocated and administration, where is that going?
The unallocated is the 5.5 million that the work groups will be working on, and that's what they'll be working on toward as they develop their budgets under the 4 different work groups. And then the administrative piece is, as Cora has been talking about earlier, administrative types of things. I know we're looking at doing a survey And as part of that survey, that will come out of the administrative piece. And I think she mentioned, Core Faith, I think you mentioned about Reuben Brown as well, doing a lot of the third party doing the verification of the businesses to make sure that they have all their paperwork turned in correctly, and they're identifying the small businesses and those types of things.
Okay, thank you.
Are there any other questions for Mr. Stevens?
Madam Chair, if you don't mind.
I don't. Go ahead, Councilman Tracus. Sorry.
Thank you, Madam Chair. Mr. Stevens, the $5.5 million that's unallocated, that's going to be considered by your working groups, and they're going to determine where that money should go. Is that correct?
Correct. But I'm sorry, I cut you off, but
No, go ahead.
no, yes, the working groups are the 4 working groups, and under that, they are going to come as part of their overall strategic plan. They're going to put in the dollars that they think that they will need, and that will be part of that 5.5 million.
And again, that 5.5 million will be awarded to small businesses at some point?
It could be.
It could be small businesses. It could be for community development. What it would take for the community to, it could be anything from, say, like you've talked about food insecurity. Could there be some type of creative program to come up for the food deserts, specifically in North County, where there are food deserts, to put in a small grocery store to go along with the food delivery that they do on the weekends that the Urban League is doing? But could you put in something permanent? That's just an example. And so could there be some type of tax credit to go along with that? That could be some type of thing that they could do as well. And that could come under community development. Workforce development could come with something of some training programs or linking up with different businesses, or how do you train individuals? And that could come in, they could use dollars in there as well. And then small businesses could come up with something as well that they would need those dollars for as well. So it's a lot of creativity coming. There's nothing that they have just yet, but they're working on all those types of things. What I just said, I use those as examples. I'm not saying that those are actual things that could happen, but those are examples. It won't be all for small business, but could be for community development, could be for workforce development and businesses as well, small businesses as well.
Okay, and it's my understanding that the county executive is going to approve an additional $2.5 million or thereabouts for grants for small business relief. Where's that money coming from?
I'd have to ask staff about that. I do not know about that.
Either.
Okay.
Cora may need her mic back.
Well, we can wait till we get to Cora, Madam Chair.
Yeah, yes. Thank you for unmuting me. I don't know how to mute and unmute myself when I'm sharing the screen. And so to answer your question, Councilman Tracus, is that right now, based on the applications that have been submitted so far from the for the Small Business Relief Program, and excluding the applicants who are going to be precluded from participating in the small business program that have already been identified, either because they are not in good standing with St. Louis County, are on the Missouri revoked sales tax list, or are on the federal contractors or the federal exclusion list. The total amount of applications, or the amount of monies that have been requested from applicants, is about $18,075,000. And so the additional 500,000 or so just to fund those specific applicants, as well as the additional $2 million that may be available or necessary to provide to all the districts so that there's equitable distribution and funding, could potentially come from that unallocated portion of the economic recovery overview. I'm sorry, the economic recovery bucket. See here and notice that we've got the ERT that Mr. Stevens was just talking about that is going to receive approximately $5 million. And so right now what we're looking at is taking that funding from that area or that bucket. So to your and Councilman Harder's question about some of the money going to small businesses, it absolutely will, just from the very fact and the nature that in order to meet all of the requests for funding that has been submitted so far for the small business program, with that $15,000 cap on the grant amount, we are looking at right now a little over $18 million.
So the additional 500,000 that you've already committed to is going to come from this 5.5 unallocated, and then if necessary, an additional 2 million will come from that amount as well. That 5.5. Possibly.
There also, we put aside for each of those different buckets 5% of whatever that bucket is for administrative costs. And so there is some flexibility for areas that the additional money can be pulled from to meet all of the requests for funding that have been submitted thus far that we're considering.
Thank you. That's all I have, Madam Chair.
Are there any other questions?
Yes, Madam Chair.
Yes, Councilwoman Days.
If they would go back to the budget screen there, at the bottom, it looked like there were parentheses around the administrative budget. In my world, the parentheses mean a deficit. Is that correct, or why is that in parentheses there?
Yes, Councilwoman Days, that's just my error in copying and pasting. That is reduced from the overall amount of the $24,150,000 that has been allocated to the economic recovery area. And so Councilman Tracus was asking earlier in the earlier slides with the budget about the numbers all adding up. And so what they should have had was something else in parentheses at $1.15 million to take away from whatever that overall amount is that we've just set aside that could be allocated or used, or that could be used rather for administrative costs, technical assistance, that sort of thing.
Okay. All right. I just wanted to check. Thank you.
Thank you. And I will be sure to send an updated version of these slides with that with the information more clearly presented for everyone.
And those numbers do add up to 24.1 million or 24,150,000. Take away the brackets.
Okay. Thank you.
Madam Chair. Madam Chair.
Councilman Harder, I was on mute.
Yes. Can we get to the 17.5 million and how we're going to get that money out the door this week in a consistent fashion among the 7 districts? Can we spend time there before we run out of time?
I'm happy to take any questions about that.
Yes. Well, I think we had a discussion over the weekend among some of the council members on a consistent way of getting this money out the door. One idea was that interim executive Page would just sign the checks and send it out himself. Or another way was to have the 7 council members involved in this like we were originally, and how we can get this out. We talked about a number of different ideas. I think we need a consistent bullet point, step-by-step program that we're all following the same process this week so that checks could be cut this week or first part of next week on a consistent and fair and equitable manner. So I would like to spend some time in that area so that we are all on the same page. And I don't know who needs to lead that discussion, if it's Rick or if it's Cora. But we need to get that done before we run out of time on this call.
Well, yeah, I will be brief and hopefully address both of the points that you just made. So first, the county executive is not going to be signing any checks, is my understanding. There's not going to be any sort of a check that people are going to receive with his signature on the bottom line. The folks from fiscal management are going to process this as it's done ordinarily. And it's my understanding that whomever is the person that normally is the provides the signature on the checks traditionally is going to be doing that now as well. To the point about council members' thoughts about really trying to streamline the process so that we can get checks out of the door. We have heard from several of you all who provided recommendations to help address that specific concern. And the county executive included in the agenda attachments or packet that went out yesterday, a letter indicating that we are going to be, or are prepared to rather, meet all of the funding requests of all of the applicants who have applied to participate in the program up to that $15,000 cap or maximum, of course, dependent upon the applicants providing the documentation that's necessary per county ordinance, state law, and federal law to execute a contract with the county and receive that money. So, we certainly have heard from all of you about trying to work through some of the sort of bureaucratic hurdles and obstacles that exist to try to get the money out of the door. And one of the key sort of adjustments that we've made to that end is to, with your approval, obviously, just provide funding to any and all of the applicants who submitted requests and applications, again, provided that they have the documentation that's required to enter into a contract to award them the money.
So the incomplete spreadsheets that we've been given over time, corrected, changed, modified, whatever, has a requested amount on that. It has an approved amount on that. So are we going to okay the requested amount, no matter what they ask for, as long as it's under 15 grand? Or are we going to approve by district the approved amount that has been screened through Reuben Brown on those spreadsheets? I think that's the first thing we need to decide. Which is it?
Sir, are you asking me, sir?
Anybody.
Okay. So it's my understanding that, and I'm not entirely sure which spreadsheet that you're looking at, because I know that there are a couple, but it's my understanding that the applicants will still have to be screened or approved from Reuben Brown, no matter what. But what we are prepared to do is have that money set aside and ready to go to all of the organizations or the applicants who have submitted a request or an application up to $15,000, provided that they give or send back the documentation that's necessary for them to actually get to actually enter into a contract with St. Louis County to receive the money.
So the spreadsheets we get from Kevin McKenna, we've gotten 2 of them in the last week or so, and on
Yes.
that spreadsheet it says, they've gone through the approval process. All the affirmatives have been answered. They say it's XYZ company. They asked for $15,000, but when it went through the process, they only got approved for $5,000. So do we sign off as the councilman for that district? Do we sign off on the $5,000, or are we signing off on the $15,000 that they asked for, and which check gets cut for which amount right now?
So let me get an answer to that question and get back to you, because I think that there is some confusion about that. Right now, it's my understanding that Reuben Brown has made a determination about who is the independent accounting firm that's been engaged to work with the county, has made a determination, to your point, about the amount that they have indicated should be received. What I am not sure of at this point is why, or whether or not that's something that they should be or would be expected to do. We want to try to do is to work with you all. I know that there are some members of the council who've simply said any organization or applicant in their district who's applied, they want to award the maximum amount of $15,000. And so let me check with the lawyers and get you an answer back before your council meeting today.
Cora, I don't mean to interrupt, but I think it would be helpful if it's possible, and you may need to check with the lawyers about this too, but it would be helpful to me to understand exactly what the scope of the work that Reuben Brown was hired to do on this project. Because to Councilman Harder's point, and I believe Councilman Tracus has raised a similar issue,
Yes.
I think we're all unclear as to why they think they get to make that determination.
Precisely.
And so any information you can get for us about the scope of the project, as well as what it is that they think or have been contracted to do, I think would be really helpful. And once we see that, we may want to speak to them. I don't.
Absolutely.
Can we find out about the possibility of that as well?
Absolutely. I'll get something to you before close of business today.
Well, and another issue, we have people that asked for $15,000 and they were approved for $850. So how does someone come up that short after they've gone through the Reuben Brown process to have that money, held back on them? Again, we need to see a consistent program here. Whereas if you're hearing that certain council members say, whatever they ask for, just give it to them. Okay, if that's going to be the policy, then we all got to be on board with that policy. Or if the policy is they can ask for whatever they want, but Reuben Brown tells them how much they're actually going to get, and that's the number we sign off on. So we got to come up with a consistent way that we're doing this, so we're not doing this 7 different ways going forward. The other piece I want to ask about is, what about the third of the applicants that we haven't heard from, that disappeared from the spreadsheets, and we don't know if they didn't turn in their paperwork, if they chickened out, they didn't want to do it. What happened to those folks, and are we still waiting on them to get screened? Where are they in the pipeline? We don't know. So I've got about a third of the original requests in my district that have disappeared off of any of the original spreadsheets that we got 9 weeks ago when this whole process started. So there's a lot of unanswered questions, and we have to be consistent. This is a lot of money, and we've got to be fair with the way it's given out. And it's not going to look very well and turn out very well if we don't do this right. That's my comment.
Thank you so much for those remarks, Councilman Harder. I understand that there have been a total of 116 applicants so far who, like I said, have been disqualified for one of those three reasons. Either they're not considered in good standing based on the work that either Reuben Brown or our own internal personnel has conducted to make that determination. They're on the Missouri revoked sales tax list or on the federal exclusion list. In total, those folks are those businesses that have been declined outright or disqualified from participating outright is 116 so far. Specifically in your district, just looking at the data that I've been provided, there were 19 applicants who were disqualified outright because they fall into one of those three different areas, meaning that even if you submit a W-9 or you figure out what your tax identification number is, for example, if you're on the federal exclusion list, you are disqualified from or prohibited from participating in any sort of funding program with St. Louis County. The others, though, that's only 19. So the others, I certainly can work with the team on this to get a breakdown, which it's something that's been requested as well from other council members for each of the applicants and each of the areas that are still pending in terms of either the documentation that they need to submit in order to be finally approved by Reuben Brown to get to you. I can certainly get a breakdown for each of the different applicants for you and for all of the council members, because that's something that's been requested. And what I do know is that the staff here on the 9th floor, as well as folks from the call center, are continuing to try to work with applicants to get the necessary documentation. And that's an ongoing sort of a process. But I can also, like I said, just get to you kind of to your point where the various applicants are in the process.
Also, we talked about early on of getting the mayors involved in the decision making, and some even to stretch it to chambers of commerce. So are we under this new rush to get these checks out? Are we cutting them out of this process, or what is the new normal when it comes to how we're going to deal with this going forward?
Well, that's something that I'd certainly defer to you all for. We just on our end are removing this step in the administration and the administrative process to try to streamline it. But I have no opinion one way or another about your decisions to continue to work with folks in making these awards. Like I said, we're just making sure that we've got the maximum amount that we can have allocated for each of the applicants, which is $15,000. But decisions or determinations about whether or not to work with other elected officials or organizations is something that I certainly defer to you all.
Madam Chair.
Sorry, Councilman Tracus is ahead of you in line, Councilman Fitch.
Thank you.
Thank you, Madam Chair. Ms. Walker, I just want to ask you a general question with respect to your entire use of the CARES Act funds, just so make sure I'm clear on it. If I understand correctly, there's basically, as you say, three buckets: public health, humanitarian, and economic recovery. Is that correct?
There are three primary programmatic buckets, correct. There are also kind of internal
Okay.
county operations that the money can be used for and is allocated.
Okay, so if I understood everything correctly today, the public health bucket has about $51 million in it, which amounts to about 30% of the total CARES Act funding. Is that correct?
Correct.
Economic relief buckets each have about 24,150,000, which amounts to 14% each of the total CARES Act money. Is that correct?
That's correct.
Was that a yes?
She said that's
Yes, that's correct.
Okay, so then if those numbers are accurate, a total of about 58% of the CARES Act money has been allocated. That equals about $100,007,000, give or take. Is that about right?
I will certainly trust your math, Councilman Tracus. I don't have a calculator in front of me, but yes,
Okay.
I think that sounds right.
So my question is, there's about $73.4 million left out of the CARES Act money. I'm just wondering what the plans are for that money.
Yes, sir. So if you look at your screen, I just shared, I had this at the end of the presentation, just in case this question came up. This is the budget, currently draft budget that has been provided. It's been tweaked a little bit, but overall, so you'll see for the sort of internal operational aspects of the county response, there's about $16.5 million, so about 10% of that total $173 million. Additionally, there is the municipal, the request that we've received from the various municipalities in the sum of $47 million that has been set aside. And then finally, there's about $10 million that that have been placed in reserve per the recommendations of our budget director and fiscal management department about this just kind of being a generally accepted principle for budgeting.
Okay.
So this is everything, and it should total $173.5 million.
Right. That's very helpful. And then I just want to guidance from the Department of Treasury with respect, guidance from the suitability or qualification, if you will, of municipalities to get any of this money.
I'm sorry, could you please repeat that? I heard a portion of it and I didn't hear it all.
I guess my question is the county still waiting to hear from the federal government, the Treasury Department, with respect to the $47 million that's been set aside as a municipal reserve? And what I mean by that, are you waiting to hear from the federal government whether or not municipalities are entitled to any of the CARES Act money that's been awarded to the county?
Yeah, so the Treasury Department has not responded to our official letter that has been sent to them requesting clarification for that answer or to that question rather. That being said, like I mentioned at the very beginning of all of this, there's been new Treasury guidance that has come out since the letter was submitted to the Treasury Department. And our county counselor's office and the lawyers are currently working through that. One of the newest pieces of guidance came out just last week on June 30th. And so they're working towards updating their analysis based on that new information and guidance that came out. But there were some pretty substantive sort of, I won't say changes, but clarifications in the guidance that would absolutely make an impact on this amount of money that the municipalities has requested.
All right, well, I'll follow up with the counselor's office. Thank you very much. That's all I have, Madam Chair.
Yes, great. Thank you. Okay. Thank you.
All right, thank you both. Councilman Fitch, the floor is yours.
Thank you, Madam Chair. Mine will be quick. Ms. Walker, thank you for the explanation. I just have one very easy question, I think. When will the first check go out on the small business relief program?
They're being processed today, Councilman
So
Fitch.
people will start receiving them in the next day or so?
No, that I can't answer, but they are being processed today, and so just however long it takes normally to cut a check and get it out of the door is how that would look. But we're expecting this week. Yes.
So these checks will be going out even with all the unanswered questions that we have generated today. Is that correct?
Well, there are some applicants who are clearly eligible for the program and can receive checks. We have heard from some of the council members about their desire to go on ahead and have, checks issued to those applicants who are very clearly eligible and meet all of the compliance criteria that's been established. And so for those, yes, the checks will be going out this week.
So just for those council districts where they have approved to send those out, the ones that have not approved
Correct.
it will be on hold. Is that correct?
Yes, we're still waiting. Yes, we would certainly want to wait and defer to you all about how to approach that. Correct.
Thank you. That's all I have, Madam Chair.
Madam Chair.
Madam Chair.
I'm going to start with Councilwoman Days since she's on the committee, and then Councilman Harder, you will follow.
Thank you, Madam Chair. I have a question about the dissemination of the funding here, and people keep saying checks. Do we have any opportunity to do this electronically, or is that just a phrase that you use? Cut the checks. I'm not sure.
Councilwoman Days, that question did come up, and we have been advised by the folks in the administration and compliance area that based on, in order to submit direct deposit, there's additional documentation that is required for people to sign up to receive direct deposit. And so just kind of based on their professional opinion as people that work in fiscal management and procurement, that because of some of the just overarching sort of obstacles that we had with many of these businesses submitting the documentation necessary to even participate in the program, that it would just be better, in their opinion, to submit paper checks. And so that is what is planned right now. But I think we take it back to the group.
Well, that's whatever, it's just the important fact is the fact that these people need to get their money, and they need to get their money as soon as we can possibly get it done.
Agreed.
And I do want to go back to, I believe it was Councilman Tracus that was requesting information about the munis and the eligibility of them to receive funding, and I see where that I'm part of the agenda, but I'm going to go ahead and say this anyway, that that at some point we're going to have to figure out how to deal with that. We're going to have to deal with that from a strategic point of view. When we're looking at the munis, I think the main municipality that was not included, it may have been, and I just missed that, would have been St. Louis County, because we have an unincorporated area that has to be taken care of. But as I look at this, I really don't see where we are even making some kind of forays into how we're going to handle these munis. As you know, I have 40. And so with the 40 that I have, some may be able to maintain, move forward, but there has to be some kind of conversation about how we can do that. And so early on, I sent a proposal, I guess, sent it to the chair, and I believe she sent it up the chain. Haven't really heard anything, but there is going to be some kind of funding request to see that happens. We need to look at deliverables for the small municipalities that we have. I think it's a little disingenuous to think that St. Louis County can absorb, if these folks don't make it, can absorb this into St. Louis County. We just don't have what it takes at this particular point. So I do want to, at this point, just say that we need to look at some kind of strategic plan in order to address the issues with the muni. 47 million, is that it? I don't think so. I don't think that we need to set a dollar amount on what their recovery or relief should look like. But I do think that we are going to have some kind of serious conversation as we move forward with these munis. So that's basically what I need to say. I will get with you, Cora, to see what kind of recommendation needs to go forward with that, or how we need to do that. But at some point, it's going to have it's a difficult conversation we're going to have, but I think we're going to have it. So that is the end of my. Did I ask a question?
Well, whether you did or you didn't, Councilwoman Days, I will also connect with the county executive's office and the county counselor's office to see what kind of a hearing or conversation, and whether it's public or closed. Let me look into that, and I will get back to everybody with some kind of follow-up, at least some action item that we can take a deeper dive into this at another time. Does that work?
I appreciate that. That works very well. Thank you.
You're so welcome. And I believe Councilman Fitch or Councilman Harder, you were next?
Chair.
Yes.
Yes. Thank you. Cora, this goes back to, I'm very confused. So you just said a few minutes ago that you're cutting checks this week. Cutting what checks? We haven't decided whether it's going to be the maximum per business or what the Reuben Brown people said they should get. So how are you determining who gets what if you're cutting checks this week?
Thank you for that question, Councilman Harder. Luckily, there were some of the applicants that submitted applications that I think you all received where the amount that they requested and the amount that they were assigned, or that was considered acceptable, if you will, were identical. And that group, or that first batch also that she received, also met all of the different compliance requirements that were established. So there not many, but there are a few that everything is ready to go in terms of what they requested and their compliance amount as well. And so for those few, there have been some council members who've indicated that they are ready to go ahead and get those checks out of the door. And so those are the ones that we're prepared to release this week. The one you said where there are some that requested a certain amount and they were assigned another amount, obviously, to your point earlier, we've got to work through those questions. But all in all, the county has determined, or the county executive has determined, that we can set aside a maximum of $15,000 for all of the applicants who have applied to the program so far. Obviously, barring the ones that don't qualify.
So if they applied for 15, they were approved for 15, you're cutting a check across the board in every district on those type of situations, correct?
Only in the districts for which council members have approved.
Right.
Okay.
That's correct. Councilman Harder, I can speak. I will only out myself. I am one of those districts. I said, no questions, no problems, cut the checks now, and we will continue working on the others where there were questions or issues, or they were rejected, but still have a possibility to get the right information in. And we will continue to fund those on a rolling basis.
So the remaining folks that are out there, are we going to actually have a piece of paper we sign off on, or do you just call in and say, give this money to these people and not to these people? How is that process? How is there any kind of paper trail or anything about that approval process?
So the remaining folks that are out there, and I guess in light of the possibility that there might be some on the list that you've received that you, as an individual council member, don't want to approve, you can just let us know, either by submitting the spreadsheet that you've received back to us. That's kind of the easiest, most straightforward way to do it. But yeah, that's how it would go.
And then finally, are we going to get some follow-up that says these companies received their check was cut on the 15th of July or whatever it is, and that they know it because when they start calling us saying, where's my check? I heard on the news that checks are going out this week. I have not gotten mine. How do we follow up to make sure that it was sent or there's not a holdup somewhere else?
Yes, the incredible team in fiscal management and the department, or the administration department, have pretty robust documentation processes, and so that they normally follow, and so that is going to continue to be followed, where they actually keep track and documentation of monies that are being dispersed from St. Louis County that are going out of the door. So they will have all that information documented.
Okay, thank you.
Are there any other questions from anyone on the committee or the council?
I have a question, Councilwoman Dunaway.
Councilwoman Clancy.
Cora, I just wanted to clarify, with the checks that are getting cut this week, are you no longer requesting any mayor recommendation for those checks?
Yeah, so that question came up earlier. Again, we are deferring to the council people.
Okay. Yeah.
Specific districts. You know, I know that there's several who have, like I said, worked with or have engaged elected officials in their various districts, as well as organizations, chambers. And so, you know, we certainly want to be respectful of that. But there are members who are who've decided, you know, who've prioritized just getting the money out of the door. And so we're trying to be accommodating to that as well.
Okay, yeah, and I did hear that earlier. I just wanted to clarify that because I know as soon as I communicate this to my mayors and the other stakeholders I've engaged, they're going to ask that question to me. So I wanted to make sure that we were clear on that answer. So it sounds like no, you all are not saying there is a requirement for the mayors to sign off on granting these checks, unless, of course, the council member for that district says that that's a part that they still want to make sure is in place.
That's correct, yes.
Okay, thank you.
Are there any other questions? All right, Councilwoman Days, I just want to be clear that item number 4, you are good with what you said earlier?
Yes, I have addressed that. Thank you.
Great, thank you so much. I think we're ready for our public comments, Diane.
I have 4 comments this afternoon. The first one is from Eleanor Pardini. I am a Maplewood City Council member. On May 12th, I supported our municipal resolution requesting equitable disbursement of CARES Act funds for COVID-19 related public safety costs. I now regret my vote. My thinking has evolved. We know more about county relief spending, and we are reckoning with institutional racism and implications for policy. CARES Act funding support the health and social needs of those hit hardest by COVID-19. As COVID-19 is intersecting with existing disparity due to racism, it is critical relief goes to those most impacted and with the greatest need. The county has the ability and infrastructure to do this. Public health, humanitarian assistance, and child care stabilization is funded. Homelessness prevention, senior care, technology to access services, and child care relief are essential. Municipal residents are county residents and can access services through the county. County decision-making is supported by staff and advisors with expertise in epidemiology, public health, housing, homelessness prevention, and economic stabilization, who are using equity indices to make decisions. Municipal resolutions request reimbursement for budgeted regular payroll of police and fire services only to municipalities with those services. The $47 million request is excessive. Only public health is designated more. Municipalities will struggle as the pandemic and recession progress, but they won't struggle evenly. Some municipalities, like my own, with less impacts of COVID-19 and strong property and sales tax, will need less relief. Others will need more. Disperse relief to provide maximal support to people experiencing COVID-19 impacts most acutely. The municipal concept of fair share will exacerbate inequity and shift resources away from health and social need. Distributing resources based on population has never produced equitable outcomes in this region and will not do so now. Ask who benefits, who is harmed, what shift will reduce racially disparate outcomes. Our community demands we reimagine what conditions and systems look like to ensure safety, health, and wholeness for people to live their best lives. We must ask tougher questions before we rubber stamp status quo requests from traditional power structures and before allocating resources to public safety over people. We must think regionally with a racial equity lens. Healthcare, housing, and education will collapse if we don't act regionally. We go farther if we do. It is time to ensure resources get to the people, communities, and sectors where they are needed most, and the county is the body to accomplish that. From Alyssa Sullivan. I'm watching how St. Louis County plans to spend $173.5 million in CARES Act dollars, and if my understanding is correct, the Municipal League is leading a coordinated effort of city managers and city councils to lobby for $47 million of CARES dollars to pay for municipalities' police and public safety costs. This seems wrong. I don't understand why CARES dollars would go to municipalities to reimburse them for regular payroll of police and fire services already accounted and paid for in existing budgets. I understand there are differing opinions on the legalities of spending CARES funds on previously budgeted items. However, even if you can make this decision legally, I think the question is, should you? About 30 municipality resolutions line up requests to be reimbursed for already budgeted and paid for regular payroll of police and fire services, not for overtime or time contributed to the Emergency Operations Center. Time that municipal first responders have contributed to the Emergency Operations Center should be reimbursed, but could be done through a program requiring municipalities to document expenses through FEMA ICS Form 214S. CARES Act money should be distributed according to need, not according to population, as suggested by the Municipal League. St. Louis County should be spending our CARES funds on things other than police payroll. That's not what CARES Act money is for. I think I'm watching a coordinated $47 million money grab by municipalities with no consideration given to whether or not they actually need that money to pay for COVID-19 relief efforts. When I see that sum relative to child care stabilization and humanitarian response budgeted at only 5.9 and 9.5 million each, I become really concerned about your priorities for fund distribution. You're going to spend 5 times more on already funded municipal police payrolls than humanitarian response at a time the entire nation is talking about defunding police in favor of bolstering social support spending. Really? If this municipal money grab is legal, I would like to be on record stating that it is ethically and morally questionable and is steeped in the intentional fragmentation of St. Louis County, which propagates systemic racism. Please do not distribute my hard-earned federal tax dollars according to this Municipal League plan. Please be ethical and non-politically motivated stewards of those dollars meant to care for us all according to our need. From Farrell Carfield. Is it true that 47 million of the 173 million St. Louis County CARES Act funding may go to police and fire departments? And for basis of comparison, I'm hearing that $9.5 million has been dedicated to humanitarian response and $5.9 million to child care stabilization. I oppose this relative prioritization. I'm worried that recent municipal resolutions will lead the county to act based on the guise that this is what cities want. If the county decides to allocate CARES funds to public safety, it is true that municipalities want to claim a share. This is not the same as municipalities advocating that public safety is a COVID funding priority. Our police and fire departments are already generously funded, especially after the increased funding via Proposition P. I ask that the County Council reconsider spending on police and fire budgets and instead work for ways to better meet true need, housing, healthcare, childcare, business recovery, and continue to account for the disparate impact of COVID rather than distributing funds based on population count. Take a quick drink. And our final comment is from Kirsten Horn. My comment is in response to the county's plan to give $47 million in federal funds to those municipalities with police and fire departments to cover payroll expenses. I am concerned that these emergency funds that are available to help municipalities to respond to the pandemic are not being distributed in a way that addresses the greatest needs of our communities. Just because federal money is available to cover budgeted public safety costs does not mean that it is the best use of that money. Just because all municipalities incur these costs does not mean that all municipalities have the same need to help cover those costs. The county should instead distribute those funds in a way that takes into account the need of our various municipalities for support and to use this money in a way that helps those members of our communities most impacted by the pandemic. Madam Chair, that is all the comments.
Thank you so much, Diane. That brings us to the end of our meeting, and I would entertain a motion to adjourn.
So moved, Madam Chair.
Do I have a second? I'll second it myself.
Second.
This meeting is adjourned. We'll see you all shortly.
Thank you.